yet another very interesting series, the Breast Cancer Awareness Series, an initiative of Integrated Health and Wellbeing Council being powered by Dr. Reddy's. So this series is aimed at awareness around breast cancer. As we are commemorating the Breast Cancer Awareness Month, which is October, Dr. Reddy's has partnered up with IHW Council for this brilliant initiative to raise awareness around breast cancer. Today's topic for discussion is around thriving beyond diagnosis. That is, improving the post-cancer breast cancer quality of life. So for that, we have very eminent panelists here with us today. I welcome Dr. Prashant Parmeshwaran, medical oncologist with MVR Cancer Center, Calicut. Sir, thank you so much for joining with us. I welcome Dr. Mithun Chaku John, who is from Jubilee Mission Medical College, Thrissur. Sir, thank you so much for joining. We would also be joined by Dr. Suresh, who is a medical oncologist with Apollo Hospital, Bangaram, Chennai, and by Dr. Prasad Eswaran, who is from Apollo Proton Cancer Center, Chennai. So with that, let us start on this discussion. So a breast cancer diagnosis can be a life-altering event, but it doesn't mark the end of one's life. It is essential to focus on living well after cancer. And we have these experts here with us who would be giving us insights and experiences on improving the quality of life post-diagnosis. So let us start. My first question is to Dr. Mithun Chaku John. So, sir, can you please talk about some common physical and emotional challenges that breast cancer survivors face when their treatment is completed? Over to you. So can you please unmute? Yes.
Yeah. Whenever a cancer patient comes to you, means they face a lot of problems actually. Not only the diagnosis, in the treatment, they have got a lot of emotional problems, family, social issues of coping with the diagnosis of breast cancer, because many a times it may be their first experience in the whole of family. So they may not have gone through all these things. So first of all is to give emotional support and the psychological support to these patients actually, so that they can cope up with the treatment, they can cope up with the diagnosis of breast cancer, so that they receive proper treatment for these, they are willing to take proper treatment, because counseling is important. Many a times when breast cancer is diagnosed, they think that it's the end of life. Whatever treatment they receive, they may not be cured of the disease. The disease will come back again. So counseling has to be given at each part, not only regarding the importance of treatment. Counseling has to be given regarding the importance of further follow-up, future treatment, also regarding the treatment what we are going to give, the adverse effects of treatment, so that we can pick up the adverse effects and treat them efficiently, so the quality of life is not impaired in such patient. And also we have to see that breast cancer, we are able to cure a lot of patients. So they have to live with these things for the rest of their life, so that they can live a better quality of life with the normal. They have to live a normal life as the normal individual. So that will be the most important part. And as doctors, we play quite an important role in not only treating the patient, also for maintaining the quality of life, so that they can lead a proper normal life as any other individual after the treatment as well.
Thank you so much, sir. We will come back to you again to discuss more in detail. So my next question is to Dr. Prashant. Sir, as breast cancer often affects not only just the individual, but also their loved ones. The entire family gets affected. So how can survivors and their families cope with the emotional impact and maintain a strong support system? Because if this is not prioritized most of the time because of whatever the relatives are saying or the society is saying, they feel really, disheartened.
Okay. So I'll tell you some sheer numbers, what our India is going through. Because all of you, those who are hearing, will know that breast cancer has suppressed all other cancers. It's a leading cancer incidence all over the world, and even in India, even though the lung cancer is coming up in a great pace, but still breast cancer holds the #1 position. So around 2016-18, when there was data which was taken out, there was around new patients with breast cancer was around 1.2 lakhs in India. It's 2.3 million worldwide. So the incidence was basically that much. So the thing that differs this breast cancer from other cancer is that around 90% of stage 1 and 2 breast cancer gets cured. So if you look at the prevalence of breast cancer, that means how many people are living with breast cancer or who has completed treatment with breast cancer. It is around, last 2016 showed it's around 5.5 lakhs. So that is the survivors we are looking here. So 5.5 lakhs of prevalence in breast cancer is a big number. So there has been, because oncology is a disease where not only the patient gets affected, the whole family gets affected. And the main problem with oncology is that you won't finish treatment in one day. You require at least 6 months of treatment. So even though 98% of breast cancers are female, the person who sits with him or the breadwinner of the family has to spend most of the time in the hospital or nearby the hospital, access to the chemotherapy unit. So majority of the time, the 6 months, the whole financial, economical, social, all budgets gets disrupted, So even though we always tell in our oncology that basically it's the whole family that suffers. But what you have to understand is that if you look at the all other cancers, the how much incidence is there and how much it's getting cured, the cure rate in breast cancer has gone too far high. So that means even though the 6 months you are having a difficult time in your life, I normally tell to my patients and the relatives like that, the 6 months will go away fast. You should not compromise on the treatment just because of the logistic support of the family. There are enough centers right now in India. I proudly tell that there are government centers, semi-government centers, and other centers where you can have a treatment with an affordable price, and all of the treatment facilities are still available. Especially if I tell about South India, it's very well available. Even in northern part of India, now the oncology has developed in such a big pace. The government is putting that much effort. So just by the logistic purpose or the financial purpose, you should not worry about treating cancer. Emotionally, you require support because you are the person who are going to be the caregiver for 24 hours. The person who is undergoing treatment, even though you tell that hair loss is temporary and everything will come back, but that's a great emotional setback for a female. Even if you tell that you remove your breast, that's not a problem. It's a mastectomy. In this 50 years, 60 years, what change it will make? But it's a trauma for a woman. So I think so. The patient is going through a lot of mental traumas. So the relatives and others has to support her rather than increasing the burden or this more pressure is coming to the whole family. I think so it should be distributed. The 6 months they have to put effort in treatment and they have to get cured of cancer, and that survivorship period is going to be as easy or as common as for any other disease, and it's more easy in oncology, I tell, because you are a diabetic, you are a lifelong diabetic, you are a cirrhotic patient, you are lifelong cirrhosis, but in oncology after 6 months you are out of cancer, you're cured. So I think so that's the best way to have or see that light at the end of the tunnel. That's how I normally tell to my patients.
Thank you so much, Dr. Prashant. Very wisely said, sir. Very strong points you brought forward. And I'm sure the audience that is watching are also taking note of all these aspects. We will discuss more on the same in a little bit. But my next question is to Dr. Suresh. So, sir, as integrative therapies and holistic approaches are gaining recognition in cancer care, can you share some insight on to how complementary therapies can support in healing and well-being of the individual?
Good evening. Thank you for inviting me. Complementary, what do you mean by complementary?
So the therapies that come along with, breast cancer, whether it may be during the breast cancer treatment phase or after recovery during the, post-treatment or post-surgery aspect.
Okay, so no, I just wanted to make clear that we are not speaking other than allopathy. So that was the thing.
No, not that, sir.
No.
So the care after the surgery of breast cancer for the duration?
Okay, I'm a medical oncologist. So, but anyway, the most important thing, as the previous speaker had been telling, it's mostly the family which has to go for the entire support. We in our hospital, we have an clinical oncology specific psychologist who has got an in-depth knowledge and who spends at least enough time with each and every patient just before starting the treatment. So this patient will be going in a conversation with the clinical psychologist what to expect and how to go about it. And the clinical psychologist can identify the persons who need a more amount of support treatment and who needs further sitting and counseling sessions. The other aspect which we in our hospital has is got an patient support group, wherein we invite the previous treated patients and who have gone through all the chemotherapeutic or surgical complications or the normal side effects of the treatment and who have come out. They are the victorious people, and they'll be able to share their experience with this newly diagnosed people. So we have a group of people, patient who have won their cancer battle and patient who are into the cancer battle. So then they have a mutual exchange, because the way the doctors speak with the patients might be very different from the patient to patient aspect. So that's how we go. And apart from this, we are also able to have some support group and crowdfunding group, which in our hospital we have, apart from the normal crowdfunding group, to support patients who are in need of financial assistance. So these are all the complementary category which we in our hospital make use of. And definitely, as the previous speaker has said, cancer is curable. And to my patients, I tell, if you are a cardiac patient, if you have an heart attack, 50 of them survive, 50 of them die without knowing that. And if you are a dialysis patient, you have a quality of life is horrible. But in a cancer patient, once 6 months of treatment is over, you're going to have a good quality of life. That's how I say my patients.
Thank you so much, sir. I will take the next question from Dr. Mithun. So, sir, as largely portrayed in the Indian film industry and the media, that which shapes the perception of the wider society with cancer, that once you get the chemotherapy done, and if you are detected with breast cancer, you would have to suffer from hair loss, appetite loss, bad skin, etc. And these picturization of people suffering with cancer shape our large society in general, or the common society who are not so medically educated. So what are your inputs for the viewers that are watching this show, so that they're made aware that, with the latest advances in, cancer care, these things are little to minimum now? So what would you like to share? So you're in mode.
Yeah. So it's regarding the adverse effects, right?
So, regarding the perceptions of
chemotherapy or the cancer treatment.
Yes.
Yeah. So definitely, whenever some patients doesn't come for treatment at all because of this false perception actually. So many times they think that the cancer treatment is so harsh on them. It's very difficult to get the treatment. Another thing is it's very costly. It's not affordable for majority of the patients. So that is the common perceptions that we are having. But right now, with I think cancer treatment has become much cheaper. It's affordable for many patients because the cost of the drugs have come down drastically comparing the last few years. And also, a lot of development has come up in cancer treatment. There are many options of means decreasing the hair loss, like scalp cooling technique, which may be available in some. There are some controversies regarding the efficacy of those, but still there is some options of decreasing the hair loss. There are certain breast cancers in which chemotherapy may not be needed. So only hormonal treatment with very less side effects. So people should be aware of such treatment so that it's not like cancer treatment means the patient will be having hair loss. The cancer treatment means, especially breast cancer treatment, patient will have loss of appetite, will have anemia, decrease in blood counts. All these things are false perceptions. May happen to certain patients, definitely may happen, but certain things are unavoidable. We may have to receive aggressive treatment to certain patients, but in certain segment of patients, it is actually individualized treatment. It's not chemotherapy for all patients. It's not like mastectomy. The whole breast has to be removed. Most of the time, right now, we are going ahead with breast conservative treatment so that aesthetic point of view is also taken care of. No need to get the mastectomy. And the radiation therapy has also improved to such a technique that the side effects of radiation is very minimized. Long-term side effects of radiation is minimized. And the treatment, chemotherapy, the immunotherapy has also improved so that the treatment is, these adverse effects of treatment is also minimized. So definitely these misconception, definitely some certain chemotherapy, definitely there will be hair loss. I'm not denying that. But not all treatment will require, means hair loss may not be present. Now we have got enough supportive medicines so that the adverse effects of chemotherapy, like the loss of appetite, the vomiting part, these all can be taken care of extremely well so that the adverse effects can be kept to a minimum. Definitely for breast cancers, which have so much curative potential, we may not be decreasing the dose. We try to give the best possible dose according to the height and weight of the patients, according to the blood parameters. We try to give the best dose so that the curative potential, the disease can be cured so that the disease doesn't come back. And at the same time, we have got enough support medicines right now so that these side effects, adverse effects, and the long-term adverse effects of the chemotherapy can be kept to a minimum. So this misconception, all these things about the dreadedness of the chemotherapy, the disease is such that the disease is not going to be cured. This has to be taken out of our mind. And most of the breast cancer, the most important part, though, as our previous speaker told, that it's the most common cancer in India, but it has got not that high mortality rate. The mortality rate is much less as compared to the lung cancer. These are the most two common cancers diagnosed in India. One is breast cancer and one is lung cancer. And if you think about the mortality rate of breast cancer, the diagnosis, the treatment has improved to such a level that we can cure majority of the cases. At least the early stages, majority of the cases can be cured and the patients can lead a normal life to the rest of the life. Now we can see that a lot of young patients are getting diagnosed with breast cancer. So the important is we have to maintain the cure to a large time and maintain proper quality of life. So this misconception regarding the adverse effects of chemotherapy and the dreadedness of the disease, that the disease cannot be cured, this has to be kept out so that majority of the breast cancer patient can complete in the.
Thank you so much, sir. We have Dr. Prasad also joined us, sir. So if you are there, I will like to take the next question from you. Yes.
Yeah, please go ahead. Yep.
Thank you so much for joining, sir. So we are talking about the topic that is improving the post-breast cancer quality of life amongst patients. So many people who get breast cancer, they are also worried about breast cancer recurrence in their life. So not only they're worried about the genetic history of breast cancer in their family, but also having to get breast cancer later in their life after getting completely treated. So can you please talk a little bit about that, share some information, and also clear out the myths around this aspect?
So the first part of the question is how to maintain the quality of life for a patient who had underwent a treatment. So I would start this answer from screening, because screening can pick up a very early disease. Earlier the disease, simpler the treatment, and absolutely there should not be any major treatment related side effects which may be persistent lifelong. So the first thing is detecting a disease which is very early in the course is the first important thing for a healthy quality of life. That is number one. And number two, when we are looking at the treatment plans, so though be different subtypes of breast cancer diseases, the treatment for certain diseases had been very much simplified. For example, you can still omit the role of radiation in patients who have a hormone receptor positive disease. Only a simple lumpectomy or a wide local excision followed by hormonal tablets. There might not be any need for chemotherapy for patients who have received a diagnosis very early in the stage of the disease, because lesser the treatment, and absolutely there's going to be a good quality of life, because there will not be any treatment related side effects. That is number one. The duration of the treatment will also be less in those patients who are diagnosed in a very early stage. We could still go ahead with 4 cycles of chemotherapy instead of the usual conventional 6 cycles of multi-drug regimen. A single drug regimen, simple regimen, lesser side effects, again translates into a good quality of life. The recurrences, especially in patients who had a very early disease, is much lesser, and the possibility of cure is very, very high. So the chances of disease recurrence in a very early stage in any subtype of cancer is less, provided the patient is motivated for a proper screening, proper follow-up, and evaluation by a qualified oncologist, be it a surgeon, medical, or a radiation oncologist. So all this put together improves the first thing, it removes the fear, because those patients would be very much be attentive and should be able to bust the myth that the cancer treatment is going to be much cumbersome, more toxic, and they are the persons who had undergone through the treatment without side effects. So they will be very more attentive and probably receptive to the follow-up schedules. And obviously the quality of life will be good in those patients, number one. Number two, the recurrence rates compared to the normal population in patients who had already got a breast cancer will be less, because they will be much more adherent to the follow-up schedules than a person who had never had a breast cancer. So when we are looking at our patients coming for follow-ups, only those patients who had a prior disease are much more adherent to their, are very much compliant to their follow-up protocols. When we say patient needs to come at 3 months, they are promptly attending the clinic at 3 months' time, rather than somebody who's not affected with cancer or who doesn't motivated for screening as such. So overall, I would say prevention is better than cure. Even when a cancer patient is detected, stage one or stage 2, or probably an early disease reduction is better than diagnosing in an advanced stage.
Thank you so much, sir. Just a one follow-up question for you. So, sir, as you said that people, so as we were discussing breast cancer recurrence, is it common for people to, get for those who have already contracted breast cancer once? Is it how are the prevalence for breast cancer recurrence? Is it too high of a number? And is the recurrence more common in those with family history of breast cancer, or is it just common for anybody regardless of family history?
So the recurrence of the disease in the same patient is much more or less, I would say, the same as that of a general population. That might occur in the breast. So mostly, most of the time, what happens is somebody is detected late. It is not happening the recurrence is not happening in the breast, but it happens in the systemic body. So in other parts of the body, say lung, liver, or any other brain. So That's right. So these patients who had undergone treatment are much more compliant for regular follow-ups. They are not at additional risk of developing recurrence compared to that of the normal population. Only thing is, again, emphasizing more on to compliance and adherence to the protocols, the surveillance protocols, follow-up schedules. That keeps the patient safe and let the patient lead a healthy life.
Thank you so much, sir. I will take the next question from Dr. Suresh. So, sir, most of the people who get detected with breast cancer have this question. Most of the women have this question that why me? And they feel that it is a end of life sentence. And there are so many things going on in their hearts and minds. When it comes to the psychosocial aspects of the breast cancer, the society is saying something, their mind is saying something, and they are believing it that they are cursed or something like that. So what are your thoughts around the same? What message would you want to give out around this? People, for women who feel this way that, this is some sort of end of life sentence.
Yeah, definitely. So whenever a patient comes to us, irrespective of whether they have a breast cancer or any other cancer, the first thing they ask us is, sir, we don't have any vices. Why should I get it? So we tell them you have many risk factors, especially if it's going to be a female, and in the present scenario where the number of children is less, the PCOD is more, breastfeeding is less. So these are all the risk factors which might add to the number incidence of breast cancer compared to their moms 30 years back when they had many number of children. Breastfeeding was more. So these are all factors which we try to explain. And then comes the next question. I don't have anyone in my family who has got this cancer. Why should I get? So I tell cancer is not an hereditary cancer. Unfortunately, breast cancer is one of the most common hereditary cancer which you can get it, because that is where more of the BRCA genes are positive. But again, you should understand, even though breast cancer is the most common hereditary cancer which you can get, it is only 1 in 20 which will be a hereditary breast cancer. Other 19 comes out of the blue. That is sporadic. It comes out of multiple gene mutations which can happen in nature, either by age or some other hormones or inherent mutational burdens. So when they come with all these questions, it is easy for us to tell them, but we also need to understand how hard it is for them to accept that. They are in a position where they might not listen to us. They'll be engaged in that they have a disease, cancer in them, rather than explaining to them. And 1 or 2 sittings may not be sufficient enough to explain the conditions. So it takes time. And as I said, when they hear the word cancer, the fear is one which clouds all their senses. They will not be able to accept the fact that, yes, they are having a cancer. Then over a period of 2 or 3 days, then they accept the fact that they have cancer and how to move forward. So we need to give time, and maybe breaking the ice or breaking the bad news should be in a structured way so that they get to know how to accept the disease and come out of the disease.
Thank you so much, sir. We would also be discussing how can we better emotionally support such individuals and families in a little bit. But before that, I will move my next question to Dr. Prashant. So, sir, as you were saying that, breast cancer treatments are well covered, at least in, the areas that you work. So we would want to know that, are all treatments around breast cancer covered by the insurance? Because out-of-pocket expenditure for health treatments, especially when it comes to cancer, can be really a lot for, middle-income families. Because in lower socioeconomic backgrounds, you have this below poverty line privileges that you can avail from the government. What about those who do not have such special cards or privileges? How can they afford good quality treatment? or do they have to think, or the doctors have to consider to whether to give one certain treatment or not, because only few treatments are covered under insurances, etc. So can you please help us understand the clear picture that is available?
Yep. So, see, treatment. This is a very important question that you had come up with. So, treatment per se doesn't stop with the doctor and the patient and the family. Patient's treatment involves a lot of cost, and especially you had brought up this very important aspect of having a good health insurance. It's not just on having an health insurance for say around 2 lakhs or 3 lakhs. It's about having a good corpus in the health insurance. That is mandatory. I had started my journey in oncology 2 decades ago, where nobody had the thought of insurance. But now we are in a timeline where everybody is at least aware of what is insurance. They have somewhat a decent amount of insurance, say around 10 lakhs or 15 lakhs, which might cover certain types of treatment, which may not be completely sufficient for all the types of treatment. But again, at least something is covered, then something not and completely not covered. So this would apply to the self-paying patients who would come to private hospitals or different uh, non-governmental hospitals. So this is number one. At least for those patients, it is always better to have something would be more than around 20 to 30 lakhs, because most of the best treatments can be covered when a patient has insurance of about 20 to 30 lakhs. So that is number one. So it is all the more prudent to have a better cover than having a minimal cover. So the knowledge of having a good health insurance, which should cover not only cancer but also other diseases, is very important. That is number one. And number two, most of the current insurances are covering the recent advanced treatment technologies as well, be it something like a proton beam therapy or immunotherapy. All these newer form of treatments are also covered by the current health insurances. So good enough. People should have the knowledge of having a good health insurance with a good corpus, as well as to cover themselves, probably a top up or a super top up policies as well. This should be a kind of educated from school or college. I think most of us were not aware of health insurances in school or college. So, financial planning, financial education has to be part of school education. So, the system needs to be changed a bit so that everybody is aware of taking care of themselves, not alone physically, mentally, but also financially. Financial health in the modern time is very, very important. So, this would be the first part for your answer. The second part would be, how do we approach the patients who come to government hospitals? I would say I started my journey in a government hospital as an oncology student, and now 20 years into the oncology practice now. A lot of changes had happened even in the government setups as well. We cannot expect everything to be provided in a government hospital, but as healthcare provider, state healthcare provider, major cities, major teaching hospitals, major academic centers do provide at least about 80 to 90% of all the current healthcare facilities, the recommended healthcare facilities, be it in terms of surgery, be it in terms of radiation or chemotherapy or targeted therapy. The latest technology, latest advanced drugs, the latest might not be available, but I would say with the facilities available in government institutions, we could cater to nearly about plus or minus 80% of the patient's needs. Unfortunately or unfortunately, cancer is a disease which keeps evolving, and the treatment also evolves. So, not all the treatment might be available in a government institution, but nevertheless, when somebody is educated from the school and spruced up during the college life, probably they should be able to take care of themselves in terms of crisis situation by having a good financial knowledge. So overall, the facilities available in India, be it a government hospital, non-governmental, charitable, private hospital, any other hospital. Times have changed. Cancer had changed from a disease of curse to a disease of possible cure. But again, it also involves the technology, the knowledge, as well as the motivation from the patient side, as well as the enlightenment.
Thank you so much, sir. I will take my next question from Dr. Prashant Nair. Sir, can you please tell us or help us understand what role does good healthy lifestyle, diet, exercise, and stress management would play? So everybody knows that while during getting treatment, this is very much essential. But for the life post breast cancer treatment, when you have already recovered, how essential it is to maintain a good lifestyle to all the audience that is watching. Yes.
So any patient post breast cancer, ideally they have to maintain a healthy lifestyle even after treatment. There have been studies which have shown that young women, especially less than 45 years of age, who are suffered from breast cancer and have got cured from that, further increasing in the body weight, obesity to be precise, is not good. There is a chance of estrogen level fluctuation, and it can produce a high recurrence rate in this group of patients. So healthy lifestyle, managing your weight, obesity needs to be on check. Your diet should be good. Exercise should be a part of your routine. And the studies has proven that post treatment weight gain has a harmful effect on the breast cancer survivorship. Having said so, it doesn't mean that you have to diet, you should not eat anything. So basically, healthy food habit means not dieting. I have seen patients who stop eating non-veg, thinking that that will produce the recurrence of breast cancer. There is nothing like that. There's nothing like you eat fish, you eat chicken, you will have the cancer comes back. That's wrong. You have to eat good food. That's what we want to specify on. That means junk foods or this outside foods or fast foods. That has to come down because of this unnecessary oils which they are used. The reusing of the oil, that may be the reason. Other than that, exercise should be a part. At least I normally tell my patients that 5 days a week, you should exercise at least 20 minutes a day. Even if it's a brisk walking, it's good. You don't walk slowly for 10 kilometers. Brisk walking for 1 kilometer is more than enough. So more than that, rather than preventing the cancer recurrence, exercise has got many other impact, because basically the treatment which you give for these cancer patients are having a lot of toxicities, especially the cardiac toxicities. We use many of the chemotherapies which can have cardiac toxicity later. So having a healthy heart is very important, because all of you are getting cured. So these people are going to live normal lifespan as a normal person. So more chance of heart attack and other things should not come in the future. So not only for a cancer recurrence per se, healthy lifestyle, food habits, and exercise should be a part. Regarding mental stress, yes. After treatment, I feel that I normally advocate going for a yoga, meditation, music, whatever makes you comfortable. Make it a habit. That helps to come out of the trauma which you have been suffering on, or the bad part of life which you had gone through. And more on that, I feel that the generalized well-being of a cancer survivor comes from himself. That means that inner part has to be good. Otherwise, there's no point at your 6 months of life, you have put this much effort, and after that, if you doesn't have, so you should not think of whether it will recur. It will recur. You asked a previous question to the speaker that whether it will recur. So the recurrence rate in a breast cancer in stage 1 and 2 is less than 10%. So you should think that you should come in this 80 and 90, not like the negative impact should not come that you will come in this 10 or 15%. Even a stage 3 has got a recurrence rate of 20 to 25% only. 75% you are going to get cured. So the more positive thoughts and other things, I think so, all this has an important impact. And the atmosphere you create in the house. I feel that majority of the time it's the females, and they are the people who keep the atmosphere in the house. So even that's important, because you should not cripple about your disease. It's just as any other disease. Or in fact, as others told, it's better than many of the other chronic illness which are coming out of this thing. Yeah, I'll stop here.
Thank you so much, sir. So I will take the next question from Dr. Mithun. So, sir, as we are talking about all the different aspects around treatment, during treatment, and post treatment of breast cancer. There are the best source to get this vital information for support is obviously from the oncologist or the specialist that are treating the breast cancer patients. But as we know, the clinicians are very busy most of the times and may not be able to provide them with adequate emotional and mental support as required while during their surgery, during their breast cancer journey, and post surgery time as well, because they might have these thoughts coming up at late at night or because of some occasion or etc., and the doctor cannot be with such person all the time, 24 hours in the day. So what sort of support groups or associations would you recommend that these people can join and be a part of, so as to regain their confidence and just for emotional and overall support that they can access?
So definitely, yeah. Communication is a big part. As everyone has discussed, communication is a big part in getting the patient know about the complications of the treatment and also the emotional support the patient is going to receive. So definitely, a patient going to treatment will have a lot of problems. So they will be very apprehensive of the treatment, and even minute problems, they will think that it's going to be life-threatening to them. So even a mild, no, means nauseating feeling, they think that it's going to be life-threatening. They don't know. So the most important part is to keep them in a group. And as one of my previous speakers have discussed, the best part to keep them in a group in which there are cancer survivors who have fought against the cancer. So what I do in my hospital is that we have got a group of cancer survivors. There are certain people who are interested in guiding the newer patients. So these patients might have completed their treatment, they have completed 5 years of treatment, or they are coming just for follow-up only. And we meet up with the newer patients. So they play an important part in counseling the patient and also in knowing, because they have gone through all these things, these minor things they will be able to know rather than us, because these subjects, these patients have gone through this and they have fought it and survived. So these cancer survivors are the best individuals. So best part is to make them part of the treatment protocol of the newer patients, make them part of the support group of these newer patients. So that is the best way to go ahead. And there are a lot of NGOs and all helping us out. The psychology department in our hospitals also helping us out in discussing each and every aspects these patients are facing while going through the chemotherapy, because it's very difficult to say that chemotherapy is easy to have. Definitely there will be some amount of side effects, and each and every part is very difficult for the clinicians to discuss with them. So it's very important to be part, clinical psychologist to be part of the treating team. So is the importance of the cancer survivors who have gone through all these things to be part of the group that can help. And definitely under the guidance of the oncologist, these groups can go ahead and help in the patients who are getting the treatment right now. So the newer patient, especially these patients who are receiving the first or second chemotherapy, they'll be going through a lot of emotional problems. They may not be knowing what is going to go ahead. So definitely a patient who has completed the treatment, who has been cured of the disease, who has got no advice, it is completely normal, to guide them out that this is going to be a short-term process and you are going to come out of this. This is going to help them in a big way. So that is one important thing that can do in getting the treatment, getting the side effects to a minimum, so that the patients become very apprehensive each and every complaints there. So that's one part. And the second part I've also discussed regarding the psychological support. So clinical psychologist helps us in a big way in counseling them regarding the problems, regarding the treatment side effects and all, and so that the patient can also discuss with them, reveal the problems, what they are facing, what they are not able to do. Many a times, very simple things like cooking for the children, they are not able to do such things during the chemotherapy. That emotional support has to be received, And the third part is to educate not only the patient, also the family members regarding the support that has to be given to the patient. So these three things are quite important in getting the complications, getting the side effects to a minimum, and getting the emotional support to the patients who are undergoing the treatment.
Definitely, sir. Thank you so much for sharing, and I'm sure all the audience that is listening are taking point of the discussions. If you would like to know more, please reach out to your oncologist, your specialist doctor that is treating you. They will be able to help you connect with the right group for sure. So thank you so much. With that, we come down to the end of this very insightful discussion. But before I let you all go, we would take one key takeaway message, as this is the last episode of the breast cancer awareness series. We would like one message from all our dignitaries for our audience to remember and keep with them for the Breast Cancer Awareness Month. So starting from Dr. Prasad, sir, your message for the audience.
Right. So it was quite a wonderful opportunity to talk to everybody through your platform. The message would be, we can win cancer. It's not just curing cancer, we can completely win over cancer, but it is all the more essential to have a proper screening, and always prevention is better than cure.
Dr. Prashant Nair, sir, your message.
No, my message is something like, I think so we are focusing very much on prevention. I think so early detection is the key. So I think so many of the breast cancers are not preventable. We have got non-modifiable risk factor. So I think so early detection is only key. So all patients should undergo all ladies should undergo a self-breast examination, mammograms, or whatever screening methods is told, and detect early, because early detection, you are having almost complete cure.
Thank you so much, sir. Dr. Mithun, sir, your message for the audience.
Definitely two things. Early diagnosis by screening. So proper screening means more chances of cure. And second part, already discussed, everyone should take health insurance and proper cancer insurance, so that if at all any problems arises, we should get the best possible treatment with best possible doctors. That's it.
Thank you so much. And with that, we wrap up this super insightful series on breast cancer awareness, an initiative of Integrated Health and Wellbeing Council being powered by Dr. Reddy's with the Be the Better Half series. I would like to thank all our eminent panelists for taking out time from their busy schedule and imparting us with wealth of knowledge and information. I thank Dr. Prashant Parmeshwaran, Dr. Suresh, Dr. Prasad Eswaran, and Dr. Mithun Chakujon for taking out time. So thank you so much for being part and sharing a wealth of knowledge and information. Thank you. I would also like to thank our partner in the mission, Dr. Reddy's, for this brilliant initiative of breast cancer awareness series, for raising awareness around breast cancer, for reaching the masses in a large number. Thank you so much. Lastly, I would also like to thank all our audience for staying with us till the very end through all these discussions. I hope these were as insightful and knowledgeable for you as they were for us. Thank you so much. With that, we wrap up now. Stay happy, stay healthy. Thank you. Bye-bye.